Okay, thank you all again for being here at our March webinar. My name is Nicole Christensen. I am the CEO of Care Answered and the author of the book From Crisis to Calm. At Care Answered, we navigate people through the healthcare system to access their best care. We get healthcare done. And so once again, I am so excited to be able to host this webinar with an expert in the field and part of what I call the Care Answered family. So without further ado, I am going to introduce our webinar today, Brain Health, How to Care for It and Keep It, and know that it is Brain Awareness Week, hence why we have such a fabulous topic. And again, let me introduce my presenter today. So Mariel Deutsch, Dr. Deutsch, is a cognitive behavioral neurologist specializing in the care of people with dementia and other causes for cognitive symptoms. She has co-authored numerous peer-reviewed scientific articles and abstracts and 2 textbook chapters. She recently earned the prestigious title of Fellow of the American Academy of Neurology. Congratulations, Dr. Deutsch. She spent years working at academic centers, teaching the next generation of physicians and participating in clinical research, all while providing exceptional clinical care. She now provides consultations in her private practice, Neurology Mind Care, PLLC in Merrick, New York. She is also just a wonderful person, a mother, and we're really happy to have her here. Take it away.
Thank you very much. Thank you so much for inviting me to talk about this very important topic. Let's see. Oops. Okay, so I'm going to first go over very briefly brain anatomy and healthy function and the difference between normal aging and dementia, and then the majority of the talk will be going over modifiable risk factors that we can focus on for dementia prevention. And just an important disclaimer first that, of course, this is informational and educational in purpose only, and not, you should not consider it medical advice. And I hope you get a lot of helpful tips from this talk, but you should always talk to your doctor before you make any changes to your healthcare. So how does a healthy brain work? So each area of the brain controls a different function. So in this picture, we have the brain divided into 4 different lobes: the frontal, parietal, occipital, and temporal lobe. And there's also the cerebellum and brainstem. And so, of course, this is a simplified overview, but just to give you a sense of things, the frontal lobe controls what we call executive function. So that's our brain's ability to problem solve, plan, organize, also memory retrieval, express ourselves with language, motor skills, some of our behavior, and emotional control. Parietal lobe, we think about in terms of integrating the senses of our touch, our ability to do math, to read, to know right from left, body orientation, and our spatial awareness. Occipital lobe is what we think about with visual processing, depth and color perception, object and face recognition. And the temporal lobe is for processing what we hear, behavior, learning, memory, and understanding language. And then the cerebellum is responsible for balance, our coordination of movement, and also some cognitive and affective control. And then the brainstem is really more of our automatic functions like breathing, consciousness, blood pressure, heart rate, body temperature, digestion. And so what is normal brain aging? Well, it's normal for certain things to happen as you get older. You get decreased volume of the brain, especially in the frontal and the temporal lobes, decreased blood flow, and we get changes cognitively, like less attention, less ability to multitask, and our speed of thinking. But there's certain things that should not change over time and should be preserved despite how old we get, and that would be skills we've learned, overlearned knowledge, our vocabulary, and our memory for faces. So a diseased brain would lead to dysfunction. So on the left, there's a picture of a healthy brain, and on the right, an example of severe Alzheimer's disease. You could see the brain is shrunken abnormally, right? And so the areas of the brain that become affected by particular disease, of course, lead to problems in those areas of function. So to use Alzheimer's disease as an example, on the bottom of that picture, that shrunken area, that's the temporal lobe, and the temporal lobe is one of the parts of the brain affected early by Alzheimer's, which is why one of the earlier symptoms in Alzheimer's disease is a problem with learning new memories. So how is normal aging different from dementia then? Well, dementia, remember, is not a normal part of aging. So dementia is just a general term that means there's a decline in memory and other areas of cognitive function, and that decline is interfering with our independence. And it's considered an umbrella term because it's really, it's not a disease by itself. It encompasses many different diseases. And so in this picture, I listed a whole bunch of different causes for dementia, but Alzheimer's disease is certainly the most common cause. Second most common is vascular dementia. And then there's something also quite common, which is a mixture of both Alzheimer's and vascular dementia, and we call that mixed dementia. Dementia with Lewy bodies is the second most common cause of neurodegenerative dementia. And then finally, just to mention one other type, which is frontotemporal degeneration, because that's the most common cause in people under 60 years old. And just some statistics for a moment on Alzheimer's disease, since it is the most common cause for dementia. These are US estimates from 2022. Almost 11% of people 65 and older have dementia. Have Alzheimer's disease, which comes to about 6.5 million people. And that number is projected to more than double by the year 2060. 200,000 people have, so of course much less, but still a substantial number have early onset dementia, which just means that the dementia occurs, the symptoms occur before the age of 65. And 2/3 of people with Alzheimer's disease are women. It's the 5th leading cause of death in the United States for people over 65. And the lifetime risk we have in women is higher than in men. It's 20% for women, 10% in men. And there's a higher prevalence in Black adults and Hispanic American adults compared to white adults. And that difference is related to disparities in life experiences, socioeconomic indicators, health conditions, all rooted in structural racism. So with all these terrible statistics, right, what can we do to try to prevent dementia? So this picture here is a summary of all the things I'm going to go over, because thankfully there are a lot of things that we could do to try to help prevent dementia. Same thing with this table. This is a summary. I'm going to go over briefly nearly all of these things, but the few things that we can't change, and one of the biggest risk factors for dementia is age. So of course, there's a higher risk the older we get. The other things we can't change are our family history and our genetics. But nearly everything else on this table, there's things that we could do to try to help prevent. So the first thing is physical exercise. In general, that's one of the best things you could do for your health, but specifically for the brain, it could help decrease neurodegenerative processes and increase neuroprotective effects. And in terms of the type of exercise, aerobic exercise has been associated with better performance on cognitive testing, larger brain volume, including in the hippocampus, which is one of the areas responsible for learning and memory, and that gets affected early in Alzheimer's disease. Aerobic exercise can also decrease cerebrovascular disease, which is like hardening of the arteries in the brain. And it could also lower the risk of mild cognitive impairment and dementia overall. And for those who can't tolerate aerobic physical exercise for various reasons, you could also just think about steps. There's been studies that show lower mortality in women who take even just 4,400 steps a day. Another study looked at the incidence of dementia, and with just 3,800 steps a day, there was a lower incidence, but the best decrease was found in people who took 6,300 steps per day. And then in terms of how quickly one has to walk in order to get this benefit, that same study showed that it should be pretty brisk to get the best benefit. So 112 steps per minute was the speed that showed the best decline in dementia incidence. The CDC has published some sample exercise regimens that I summarized here. So the first is moderate intensity aerobic activity that should be done for 150 minutes a week. So that comes out to 5 days a week, 30 minutes a day. And moderate intensity aerobic activity would be things like a brisk walk, some forms of yoga, cycling, and water aerobics. And you could think about it as the level of activity should be enough where you wouldn't be able to sing, but you should be able to speak. And then in terms of The other types of exercise that are really considered optimal for brain health, we also have not just aerobic activity, but muscle strengthening exercises are supposed to be done twice a week. And that's like lifting weights, using resistance bands, or doing some heavy gardening. And then also balance activities 3 days a week, like walking backwards, standing on one leg, using a wobble board, or doing Tai Chi. Second regimens that the CDC published is the same when it comes to the muscle exercises and the balance activities, but the level of aerobic activity, instead of being moderate, they talk about vigorous activity, and that would be about half the amount of time. So only 75 minutes a week, which is thinking about it 25 minutes at a time, 3 days a week. So that would be like jogging or running. And when it's vigorous activity, it should be at the point where you really can only say a few words before you need to take a breath. And that's how you know you're doing, a vigorous level. So, this is a very tall order for people. So going by just what I was mentioning before about steps even being very important and even can lower your mortality and incidence for dementia, it's important to just start somewhere. So if all you could do is walk for a few minutes a day, then that's where one should start. Okay, next category to focus on for dementia prevention would be controlling risk factors for heart health, because all the same risk factors that affect the heart affect the brain. And so vascular risk factors and metabolic syndrome have been associated with an increased risk of stroke and dementia. So what do we mean by these vascular risk factors? Well, high blood pressure is a big one. And the goal blood pressure should be less than 120/80. High cholesterol. And so, and that has to do with optimizing the good cholesterol, which is the HDL, but minimizing the bad cholesterol, the LDL, and the triglycerides also. Diabetes. So the goal of fasting sugar should be less than 100. And then obesity. So you should have a normal body weight for your height. These are very common conditions. And so it's important that if the person not only gets to see their doctor regularly to check if they've developed any of these conditions, but if you do have these conditions, then to work with your doctor on doing whatever steps they think appropriate, including, taking medications in order to monitor the condition and try to keep your levels in the optimal ranges. Next in the category of substance use, so tobacco, drugs, alcohol, smoking, all have been associated with increased risk for dementia. So the goal for tobacco use is none. Same for recreational drugs. And with alcohol, it's a little trickier. So we know that more than 14 drinks a week has been associated with dementia. There's still a question as to whether less amount of alcohol, and specifically red wine, whether that's actually beneficial. It's not at the point where it's a clear recommendation. People don't really, it's not a standard level recommendation to tell somebody to certainly start drinking, but definitely to not over drink. So less than 14 drinks a week. Next would be sleep. So sleep quality and quantity are both very important. When we think of sleep quality, we're talking about sleep apnea, and sleep apnea can increase the risk for dementia in a few different ways. So when a person has disrupted sleep, first of all, you don't feel great the next day. You could have cognitive symptoms just because you didn't get a good night's rest, right? And that could lead to fatigue and irritability and just not being at your best. But in terms of physiologically, when you have disrupted sleep with sleep apnea, it can increase the risk for oxidative stress and promote Alzheimer's pathologic changes. And then the other thing is we think about oxygen desaturation. People with sleep apnea often have a low oxygen level when it's not treated. And that contributes to dementia too, and could accelerate the deposition of a protein called amyloid in the brain. And that amyloid protein is one of the defining characteristics of Alzheimer's disease. And so most people don't know that they have sleep apnea. Sometimes the only symptom could be snoring. And so it's important to talk to your doctor about whether there is a reason to be tested. And so some of the symptoms people might have that could indicate sleep apnea would be certainly snoring, but also waking up frequently in the middle of the night. A lot of times people, like men, would think that, it's their prostate and that's why they're waking up to go to the bathroom. But actually, sometimes sleep apnea wakes a person and they don't realize it. And then once you're awake, you realize your bladder's full. And so another symptom to think about is also if you wake up and you don't feel well rested, or sleeping longer hours and still not feeling well rested, and that's your brain trying to compensate for poor sleep quality by increasing the sleep quantity. So really the only way that one can know for sure whether they have normal sleep quality is to get a sleep study. And at least the good news is if you do have sleep apnea, it's very treatable, and that would help mitigate that increased risk. And then in terms of sleep quantity, we know that sleeping less than 6 or less hours a day is associated with a higher risk for dementia. And so the goal really is to try to get at least 7 hours. Diet is next. Diet's a huge topic. In terms of the most brain healthy diet we know, it's called the MIND diet. So that's a diet that's based on both the Mediterranean diet and something called the DASH diet, which was developed for people with high blood pressure. And so this is a diet that emphasizes the consumption of 10 brain healthy foods and limiting the intake of 5 unhealthy foods. And so the healthy foods are green leafy vegetables, nuts, berries, olive oil, chicken, fish, beans. And then the foods to try to minimize are red meats, fried foods, pastries, cheese, butter. And studies showed that people who followed this type of diet had less cognitive decline over time as they aged, and that there was also less development of Alzheimer's disease. Another big topic is vitamins and supplements. I want to make the distinction between treating a vitamin deficiency versus taking an individual supplement without a deficiency. So the standard of care when it comes to working somebody up for memory problems is to check particular vitamin levels, because some B vitamins and vitamin D are associated with cognitive decline and dementia. And so if a person is found to have certain deficiencies, of course, then their levels should be supplemented. But in a person who doesn't have a deficiency, there is no proof that taking individual supplements over the counter can be beneficial in terms of preventing dementia. Now, separate from that is the question of whether taking a multivitamin every day can be helpful. And there's been some mixed results on that. So a study from 2013 looking at just older male physicians found that there was no benefit. But now just in 2022, there was a benefit found. It was specifically using Centrum Silver, which is the multivitamin for, I don't remember if the cutoff is 50 or older than that, that the silver brand is used for. But it showed that people who took one a day had improved cognitive function over 3 years' time. And it was especially helpful in people who had a history of cardiovascular disease. So that might be something where, potentially taking a Centrum Silver a day in the appropriate person might be beneficial. And then finally, there's huge industry when it comes to memory supplements, right? These other over-the-counter drugs that are said to be beneficial for memory. And none of those are at the point where specialists are really recommending people take that as dementia prevention because they've not actually proven themselves to be beneficial. And of course, any drug that claims that it could have a positive effect could always have an adverse effect. So I always caution people against using those drugs which are not proven. Next, we think about social engagement when it comes to trying to prevent dementia. Social isolation is a risk factor, and social isolation has been defined as having contact less than once a month with family, friends, or religious organization, an organized group, or volunteering, right? So any level of interaction like that, less than once a month is considered, one is considered to be in the social isolation category. And so, of course, then the antidote for this would be to get active. And what would be great is to combine social engagement with mental exercise, right? Because continued mental stimulation is very important. We know that people who have a higher cognitive reserve, which means the number of years of education or cognitive enrichment that they've achieved, we know people, with this higher cognitive reserve have a lower incidence of dementia. And so continuing to keep mentally active is very important. You can't change the number of years of education you've already had, but you can continue to lead a very active lifestyle. And if you combine that with, if you combine the activities with, doing it with others rather than just alone, right, then you're kind of doing two beneficial things at once. And so, and this could really be anything, right? Thinking about hobbies that maybe in a person who's retired, they always wanted to do something or learn something, they never gave themselves the time to do it. It's a perfect time to learn a new language or learn how to play an instrument. Just playing games, like card games or dominoes or mahjong. Having a daily outing to a store with a friend, right? That's better than staying at home and being by oneself. Volunteering is, of course, also great, and even just a simple meal with family or friends. Brain game apps, that's another area to think about. There is an app that's been shown to be helpful. Brain HQ is an app that there's been a lot of scientific studies that have tried to look at whether it's beneficial or not. And they did publish that one of the games within that app which was a processing speed training game. People who did that showed an improvement in their instrumental activities of daily living. So that's a measure of, how well somebody is actually functioning in real life. And they had less development of dementia. This was a 10-year study. So that's actually, that's a big deal. So when it comes to thinking about, is there some game that maybe we could do now that might be helpful? This one might be one. Other commercially marketed products, it's not necessarily, the knock on all of these things is that you might get better at the game itself and on the app, but that who knows if that actually translates into real life performance. But at least in this study, with using that particular game, Brain HQ, there was a real life performance improvement. So this would be the type of thing where maybe somebody does it for a few minutes a day in the morning, or if you are waiting in line somewhere, or at a doctor's office that you're sitting and waiting, right? Then instead of maybe scrolling through something mindless, then doing one of these games would be a better use of your time. Accident prevention, that's another big category. So first I'll mention traumatic brain injury. So somebody who's had a head injury with loss of consciousness has a higher incidence of dementia. And the more head injuries one gets, the higher the risk. And that includes people who've had head injuries that didn't necessarily lead to loss of consciousness, like what repetitive subconcussive injuries, like you might see in contact sports. So players of various contact sports, there's a higher incidence of dementia in people who played football, soccer, rugby, boxing, ice hockey, and I'm sure others. But we're not only talking about accidents that can occur with athletes. Also, just a fall in an older person can really be a huge turning point. And so what unfortunately is very common is somebody has a fall, they break a bone, they have to be hospitalized, maybe they need a surgery to fix it, maybe not, and then delirium develops in the hospital. And then people who get delirium have a higher risk of developing dementia later. And unfortunately, something I have commonly heard is, the person went into the hospital, they came out, they were never the same again. So preventing accidents of all types is really important. Next I'll talk about mood and stress. This is a huge topic, which, all these categories could deserve their own talk, but especially I think mood and stress. So depression, anxiety, and stress, all of this has been associated with an increased risk of dementia. But you could also have symptoms that mimic dementia when you're under stress or have untreated or undertreated depression and anxiety. And you could think of it as, we all only have so much mental energy. And so if your mental energy is kind of trapped in thinking about your plans for the day or reliving the conversation you had with someone that upset you, or, all the other things that we run through in our minds, right? Then when somebody's having a conversation with you, it's like you're on another planet. Like you might be nodding your head and it looks like you're listening, but you really didn't hear anything because you were having this whole other conversation with yourself, right? And so you only have limited mental energy available to others when you're doing that, right? And so you're really not present. So it leads to people functioning on autopilot, as if they're numb. right? You walk into a room, you forget what you were looking for. And so, and then of course you get worried, right? And that leads to more stress and more anxiety, because then you think, oh my God, do I have early Alzheimer's disease? Somebody just said something to me, I have no idea what they said. And so it's important to remember that, treating depression, anxiety, and stress actually overall, years down the line does lower dementia risk, but also in the short term, you free the trapped mental energy, right? And then you actually can improve the errors. And it all comes down to the lack of mindfulness that you're experiencing and fixing that. So in terms of how to improve mindfulness, meditation is excellent for that. So there's many different types of meditation. The next slide, I'll go over just a few types, but there's so many different types. But the goal overall is to try to reach a state of relaxation and calm presence in the moment. And it's been shown to decrease stress, decrease anxiety and depression, and just overall improve psychological well-being. It can improve focus and memory. And then there's also physiologic changes that happen. Meditation's been shown to alter brain volume, network activity in the brain, and functional connectivity. And then also just calm your sympathetic nervous system, that fight or flight mode that we get into, that becomes improved with meditation. So here I highlight 3 different types. The first, of course, I don't know all the different types, but I chose these 3 for a reason. The first type is mindfulness-based stress reduction. And so in terms of what mindfulness means, actually, just think of it as a process of directing focus to the present moment and accepting all the thoughts, emotions, sensations, and all the experiences you're having in that present moment without judgment. And so this is something that's taught in an 8-week course. There's a free course for this at palousmindfulness.com. So that's been shown to lower stress. The next type of meditation is transcendental meditation. This is one that I have personal experience with. Has to be taught in person. tm.org is the website to find somebody to teach it. And this is supposed to be done 20 minutes at a time twice a day. So 20 minutes in the morning, 20 minutes in the late afternoon or evening. And in this type of meditation, it's a bit different. It's supposedly simpler than some others. You use a mantra, which the person teaches you, to help what they call transcend the process of thought and to reach a state of deep inner calm. And then finally, the third type of meditation I'll mention is something called Kirtan Kriya. I hope I said that right. It's 12 minutes done, 12 minutes a day. And this is also mantra-based, but it involves singing the mantra, not just saying the mantra like in your mind, like with TM. So you sing this mantra while repeating sequential finger movements. And there's the website alzheimersprevention.org shows some like picture examples of how to perform that type of meditation. And then of course there's different apps that you could download to try to help with this. Calm is one, Headspace is another. The goal of whichever one a person chooses, the goal is of course to improve your mindfulness, lower your overactivated nervous system, and just be more present so that you don't so that not only you're lowering your risk for dementia overall, but that you are just functioning better while you're in a more present state. Okay. Next topic is that's important for lowering dementia risk is thinking about all your senses and optimizing them. So hearing loss and vision loss have both been associated with increased risk for dementia. And the theme with these sensory losses is in terms of the mechanism, one is that they can lead to social isolation. And of course, we know, as I mentioned already, social isolation by itself is a risk factor for dementia and causes less cognitive engagement, right? So that's one mechanism. Another is that when you have hearing and vision loss, then the relevant parts of the brain that receive the visual and auditory information are not activated as much. And so if it's like a use it or lose it. So if you're not activating those parts of the brain, then they shrink. So the brain atrophy is what you get. And then also, the next mechanism you could think of is that when you have hearing and vision loss, you are using excess mental energy just for that, that basic sense, to hear and to see, and that increases your cognitive load. And then you have less available resources for committing the information, to memory, right? So if you don't hear something that someone said, obviously you can't be remembered to expect to remember it later. And then if you're not seeing something properly, then the next time you see it, it may not look familiar, right? So that could also make the symptoms somebody has, it could be a big confounder. They might the person might look more impaired than they really are. And so the fix for this is to get regular evaluations of, regular checkups for hearing and vision. And then when impairments come, to treat them early before some of the permanent changes set in. Okay, and finally, avoiding toxins. So various toxins have been associated with increased dementia risk. So this is another slide with so many different topics kind of buried in it. There's different types of toxins to think about. So in the air pollution category, we think about secondhand smoke, but also nitrogen oxides, particulate matter, ozone. Then there's the biotoxin category. So there's been certain bacterial, viral, and fungal infections that have been associated with increased risk for dementia. Then there's metal toxins like lead and mercury and others, pesticides. So many different things that can increase our risk. And then the pathway that kind of connects all these things is that any one of these toxins, what happens is you get neuroinflammation and increased oxidative stress that can lead to neurodegeneration and then different dementia pathology. Okay, so that was a whirlwind, but in conclusion, I hope the points that you took away from this were dementia is not a normal part of aging. There are many different causes for dementia, but there's no cure yet for the most common cause, which is Alzheimer's disease. But that doesn't mean there aren't so many things that we can do. And as the same picture from earlier depicts, there's over 20 different lifestyle, medical, and environmental factors that can all increase our risk, which we have control over and can be addressed to help reduce our risk of dementia and protect our brain. Well, for anyone interested, many references. Thanks again to Nicole for inviting me and my contact information.
Excellent. Thank you so much. That was so informative. It was chock full of information. That was so helpful. I want to tell everybody, I'm going to be looking in the chat, and you can unmute yourselves too if you want to ask a question directly. But Mariel knows this, but I was actually watching PBS, and I was learning, right? I
was going to point that out, and I said, oh, let me hold up.
No, it was great. So I was learning all sorts of things, which we do on public television, generally speaking. And it was about brain health. And did I meet you like the next day or something? It was something meant to be. Yeah. And so I was like, oh my goodness, the world needs to know. So it was just meant to be that we were to meet and that you give us this great information. And one of the things that was in common was I said, I heard about this brain exercise, and she's like, that's the one that works.
Right.
So the brain HQ.
Yeah.
So again, thank you, PBS. But anyway, thanks again. This is very informative. Does anybody have any questions? I'm going to look in the chat. There's nothing in the chat. That was so thorough. You can take yourselves off mute if you'd like. And any questions you may have. Let's see. And if you can't take yourself off mute because I put you on mute, let me know. Because that happens. All right. Well, you were incredibly thorough, so I'm not that surprised. That there are no questions.
I just wanted to say thank you. It was very, very informative.
Oh, thank you. Like I said, with a few of the particular each slide deserves its own talk, right? I mean, there's so much to talk about with each thing, but hopefully, just piques everyone's interest to think about and tackle each thing that you can.
That's right. Take care of ourselves and our loved ones. And the information for Dr. Deutsch is up there. I just think it's a spectacular service to be able to have here. So thank you so much for all your work. And thank you all for coming today.